Ketamine. Expanded lecture notes. Ketamine is a medication used in medicine for anesthesia, for starting and maintaining anesthesia. Pain management, sometimes for chronic pain. Psychiatric uses. Research into treatment-resistant depression. Ketamine has effects on the brain involving NMDA receptors. Do you want to know more about ketamine's clinical uses? Side effects or risks? Mechanism of action. Introduction to ketamine. 1. Ketamine is a dissociative anesthetic with unique properties, providing sedation, amnesia, and profound analgesia while preserving airway reflexes and spontaneous respiration. This means ketamine helps patients feel detached from their body and pain during medical procedures, while generally keeping them breathing on their own. 2. It is widely used in anesthesia, emergency medicine, and critical care, especially in unstable patients and situations where both anesthesia and analgesia are required. This makes ketamine valuable in situations like trauma care or when patients are hemodynamically unstable. Definition of ketamine. 1. Ketamine is a phencyclidine (PCP) derivative that induces a trance-like state with analgesia, sedation, and amnesia. This means ketamine causes patients to enter a dream-like state where they don't feel pain, are somewhat sleepy, and don't remember much. 2. It is characterized by dissociative anesthesia, where the patient appears conscious but is disconnected from their environment. This means patients might look awake but aren't really aware of or interacting with what's happening around them. Classification of ketamine. 1. Pharmacological class. Dissociative anesthetic. This means ketamine works by disconnecting the brain from the rest of the body, causing a unique type of anesthesia. 2. Chemical class. Aryl cyclohexylamine derivative. This describes ketamine's chemical structure, relating it to a group of compounds with similar properties. 3. Therapeutic class. General anesthetic, analgesic. This means ketamine is used both to induce a state of anesthesia and to provide pain relief. Chemical properties of ketamine. 1. Chemical name. Plus or minus -2-O-chlorophenyl, -2-methylamino cyclohexanone. This is the formal name describing ketamine's chemical structure. 2. Molecular formula. CHClNO. This shows the composition of atoms in a ketamine molecule. 3. Molecular weight. 237.73 grams per mole. This is the mass of one molecule of ketamine. 4. Structure. Racemic mixture of R and S enantiomers. S-ketamine is more potent. This ketamine is made of two mirror image forms, with the S form being more active. 5. pKa. Approximately 7.5, partially ionized at physiological pH. This indicates ketamine's ionization state at body's normal pH, affecting how it works in the body. Physical properties of ketamine. 1. Appearance. Clear, colorless solution. This describes how ketamine looks in its injectable form. 2. Solubility. Water soluble. This means ketamine dissolves in water, making it suitable for injection. 3. Formulation. Injectable solution 10 mg per milliliter, 50 mg per milliliter, 100 mg per milliliter. These are common concentrations of ketamine used in medical settings. 4. Stability. Stable at room temperature and light resistant. This means ketamine doesn't degrade easily when stored properly. Mechanism of action of ketamine. 1. Primary. Non-competitive antagonist at N-methyl-D-aspartate, NMDA, receptors, blocking excitatory neurotransmission. This means ketamine mainly works by blocking NMDA receptors in the brain, which affects pain and consciousness. 2. Secondary. Interaction with opioid receptors, monoaminergic receptors, and voltage-gated calcium channels leading to contributes to analgesia. This means ketamine's effects on pain are also helped by interactions with these other systems. 3. Reduces functional dissociation between the thalamocortical and limbic systems. This explains how ketamine causes a dissociative state, disconnecting parts of the brain dealing with sensory processing and emotions. Pharmacokinetics of ketamine. 1. Onset IV 30 to 60 seconds. 2. Onset IM 3 to 5 minutes. 3. Duration 10 to 15 minutes IV, 20 to 30 minutes IM for anesthesia. 4. Distribution. Rapid, large volume of distribution, approximately 3 L per kilogram. 5. Protein binding. Tilde 25-50%. 6. Metabolism. Hepatic CYP 450 enzymes, mainly CYP3A4, norcotin, active metabolite. 7. Elimination. Renal excretion. 8. Half-life. 2 to 3 hours. Pharmacodynamics of ketamine. 1. Produces dissociative anesthesia with intense analgesia and amnesia. This means ketamine causes a unique type of anesthesia with strong pain relief and memory loss. 2. Cardiovascular. Increases HR, BP, and cardiac output due to sympathetic stimulation. This means ketamine can raise heart rate, blood pressure, and how much blood the heart pumps out. 3. Respiratory. Minimal depression, bronchodilatory effect. This means ketamine doesn't slow breathing much and can even open airways. 4. CNS. Increases cerebral blood flow and intracranial pressure. This means ketamine can affect blood flow in the brain and pressure inside the skull. Clinical uses. 1. Induction and maintenance of anesthesia. 2. Procedural sedation in adults and children. 3. Analgesia for acute and chronic pain, especially in opioid-tolerant patients. 4. Pre-hospital and emergency rapid sequence intubation. 5. Bronchodilation in status asthmaticus refractory to standard therapy. 6. Low-dose infusion for depression and refractory pain, off-label. Use of ketamine in ICU. 1. Sedation and analgesia in hemodynamically unstable patients. This means ketamine is useful for sedating and relieving pain in ICU patients who have unstable blood pressure or circulation. 2. Adjunct for procedural sedation in critically ill. This means ketamine can help with sedation during procedures in the ICU. 3. Control of severe agitation, delirium in intubated patients. This means ketamine can help manage agitated or delirious patients on ventilators. 4. Low-dose infusion for opioid-sparing analgesia. This means ketamine can help reduce pain while using fewer opioids. 5. Useful in patients with bronchospasm. This means ketamine can be beneficial for patients with narrowed airways due to its bronchodilating effect. Use of ketamine in anesthesia. 1. Induction in trauma, hypovolemic shock, or high-risk cardiac patients. This means ketamine is a good choice for starting anesthesia in patients with trauma, low blood volume, or serious heart issues because it tends to support blood pressure. 2. Maintenance of anesthesia in combination with other agents. This means ketamine can be used along with other anesthetics to keep patients under anesthesia. 3. Useful in pediatric anesthesia and short procedures. This means ketamine is often used for kids and for breech surgeries. 4. Prevents hypotension in patients at risk during induction. This means ketamine can help avoid low blood pressure in vulnerable patients when starting anesthesia. Use of ketamine in emergencies. 1. Rapid sequence induction in unstable patients. This means ketamine is used for quick induction of anesthesia in patients who are unstable. 2. Analgesia in mass casualty or pre-hospital settings. This means ketamine can provide pain relief in emergency situations like disasters or before reaching a hospital. 3. Sedation in patients with severe bronchospasm. This means ketamine is helpful for sedating patients with severe narrowing of the airways. 4. battlefield or disaster anesthesia when monitoring is needed. This means ketamine is valuable in emergency situations with limited resources for monitoring patients. Administration and dosage of ketamine. 1. Induction of anesthesia. 1. IV, 1 to 2 mg per kilogram bolus. This is a typical dose for starting anesthesia through a vein. 2. Induction of anesthesia. IM, 4 to 6 mg per kilogram. This is a typical dose for starting anesthesia through a muscle injection. 2. Maintenance. 1. IV infusion. 0.5–1 mg per kilogram every 10 to 15 minutes or continuous infusion 0.5–2 mg per kilogram per hour. This means ketamine can be given repeatedly or continuously to maintain anesthesia. 3. Procedural sedation. 1. IV, 0.25–0.75 mg per kilogram. This dose is for sedating patients during procedures via IV. 2. IM, 2 to 4 mg per kilogram. This dose is for sedating patients during procedures via muscle injection. 4. Analgesia, sub-dissociative dose. 1. IV infusion. 0.1–0.5 mg per kilogram per hour. This lower dose is used for pain relief without full dissociation. 5. Asthmaticus. 1. IV bolus. 0.5–1 mg per kilogram, then infusion 0.5–2 mg per kilogram per hour. This means ketamine can be used to help in severe asthma attacks. Side effects of ketamine. 1. Emergence reactions, hallucinations, vivid dreams, agitation. This means some patients might experience unsettling experiences as they wake up from ketamine anesthesia. 2. Nausea and vomiting. This is a common side effect of ketamine. 3. Increased salivation. This means ketamine can cause patients to produce more saliva. 4. Nystagmus and diplopia. This means ketamine can cause abnormal eye movements and double vision. 5. Mild increase in intracranial and intraocular pressure. This means ketamine slightly raise pressure in the brain and eye. Serious side effects of ketamine. 1. Laryngospasm, rare. This means a rare but serious spasm of the voice box can occur with ketamine. 2. Severe hypertension in high doses. This means high doses of ketamine can cause very high blood pressure. 3. Increased intracranial pressure in patients with head injury, controversial. This means there's debate about whether ketamine raises brain pressure in head-injured patients. 4. Hallucinations causing severe agitation, more common in adults. This means some adults might experience severe agitation and hallucinations after ketamine. Contraindications of ketamine. 1. Known hypersensitivity to ketamine. This means ketamine shouldn't be used if a patient is allergic to it. 2. Conditions where a marked increase in BP is hazardous, e.g., uncontrolled hypertension, aortic dissection. This means ketamine should be avoided in patients where a big increase in blood pressure could be dangerous. 3. Elevated intracranial pressure, relative, controversial. This means there's debate about using ketamine in patients with high brain pressure. 4. Severe coronary artery disease or myocardial ischemia. This means ketamine should be used cautiously or avoided in patients with severe heart artery disease or heart muscle ischemia. Precautions for using ketamine. 1. Use with benzodiazepine, e.g., midazolam, to reduce emergence reactions. This means giving a benzodiazepine with ketamine can help minimize unsettling emergence experiences. 2. Use cautiously in patients with psychiatric disorders. This means ketamine needs careful consideration in patients with mental health conditions. 3. Caution in glaucoma or increased intraocular pressure. This means ketamine should be used carefully in patients with eye pressure issues. 4. Avoid rapid IV bolus in patients with cardiovascular risk. This means giving ketamine slowly through IV is safer in patients with heart risks. Advantages of ketamine. 1. Provides both anesthesia and analgesia. This means ketamine gives pain relief along with anesthesia. 2. Maintains airway reflexes and spontaneous breathing. This means ketamine doesn't usually suppress breathing or airway protective reflexes. 3. Increases BP and HR, useful in shock. This means ketamine can help support blood pressure and heart rate in patients in shock. 4. Potent bronchodilator. This means ketamine can help open up narrowed airways. 5. Multiple administration routes IM, intranasal, oral. This means ketamine can be given in different ways depending on the situation. Disadvantages of ketamine. 1. Hallucinations and emergence phenomena. This means some patients experience unsettling experiences waking up from ketamine. 2. Increased salivation may require anticholinergic premedication. This means ketamine can cause more saliva production, possibly needing medication to counteract it. 3. Increased intracranial and intraocular pressure. This means ketamine can raise pressure in the brain and eye. 4. Delayed recovery compared to ultra-short-acting agents. This means patients might take longer to fully recover from ketamine compared to some other anesthetics. Clinical considerations for ketamine. 1. Ideal for unstable trauma patients and those with bronchospasm. This means ketamine is a good choice for patients with trauma who's unstable or has narrowed airways. 2. Co-administer benzodiazepine to reduce psychological side effects. This means giving a benzodiazepine with ketamine can help minimize unsettling psychological experiences. 3. Monitor for hypertension and tachycardia. This means patients on ketamine need watching for high blood pressure and fast heart rate. 4. Consider suction readiness for waste secretions. This means being prepared to suction because ketamine can cause more saliva and secretions. 5. Avoid in patients with significant ischemic heart disease unless benefits outweigh risks. This means ketamine should be used carefully in patients with serious heart artery disease. Comparison of ketamine with other agents. 1. Analgesia. Ketamine provides analgesia. Propofol, etomidate, and midazolam do not. 2. CV effect. Ketamine increases BP and HR. Propofol decreases BP and HR. Etomidate and midazolam have stable cardiovascular effects. 3. Respiratory effect. Ketamine causes minimal respiratory depression. Propofol and midazolam cause significant depression. Etomidate causes minimal depression. 4. Onset IV ketamine and etomidate 30 to 60 seconds. Propofol takes about 30 seconds. Midazolam takes 1 to 5 minutes. 5. Duration. Ketamine lasts 10 to 15 minutes. Propofol lasts 5 to 10 minutes. Etomidate lasts 3 to 10 minutes. Midazolam lasts 1 to 2 hours. 6. Bronchodilation. Ketamine is a bronchodilator. Others are not. Conclusion about ketamine. 1. Ketamine is a versatile, hemodynamically supportive anesthetic that provides both sedation and analgesia while preserving airway reflexes and respiratory drive. This means ketamine is useful in various situations while supporting the patient's circulation and breathing. 2. Its cardiovascular stimulating effects and bronchodilation make it invaluable in trauma, shock, and asthmatic emergencies. This means ketamine is particularly helpful in emergency situations involving trauma, low blood pressure, or severe asthma. 3. However, psychological side effects and increased secretions require careful mitigation. This means ketamine's potential for causing unsettling psychological experiences and more saliva needs to be managed. In the chaos of trauma, ketamine is the anesthetist's friend. It keeps the heart beating, the airway open, and the pain at bay. Emergency anesthesia principle. This means, in stressful trauma situations, ketamine is a useful tool for anesthetists. Ketamine helps support heart function, keeps the heart beating. Ketamine helps maintain airway reflexes and breathing, the airway open. Ketamine provides pain relief, the pain at bay. Thank you for watching. If you like this content, don't forget to like to show your support. Comment and share your thoughts. Share with your friends and family. Subscribe for more exciting content. Your engagement means the world to us. Stay tuned for more.